Hello, it's FEMGUARDIANS here, and we are going to take you through our solution, HerHealth AI. So this is basically the landing page, and it's welcome to HerHealth AI, where you can predict your cervical cancer risk with confidence. So below it there is a button where you can start risk assessment, but we need to log in first before you start the risk assessment. When you scroll down, there is more information like why you choose HerHealth AI. So one, it's AI powered analysis. 2, personalized care, and also 3, local resources where you can find nearby clinics and healthcare providers with NHIF coverage information. So we are going to log in first as the patient. So this is the login form, and my name is, let's use Fatma, and her email address is fatma@gmail.com. Her password, let's put it 12345 6. So select account, patient, then sign in. It will direct you to the, not now, it will direct you to your health dashboard where you can enter your name Fatma and the day you are born. So we're going to use early 2000. Let's say she's born in the 2000 at January 1st. So access my dashboard. So this is the landing page of dashboard. So welcome Fatuma, and you can start your risk assessment. Below it there is like your care plan, and schedule pap smear within 3 months, consider HPV vaccination. There is also educational resources. Let's say Fatima doesn't understand what cervical cancer is, so you understand cervical cancer, HPV vaccination guide or screening guidelines, healthy lifestyles and tips, and also you can symptom track. There's a symptom tracker. Do you have, what symptoms are you experiencing? Basically unusual bleeding, pelvic pain, back pain, painful urination. Then you can submit your symptoms, and the doctor will be able to see your symptoms in his or her dashboard. We will log in as the doctor. So start risk assessment for Fatima, and it will ask you what's your age. You select your age range, and we're going to use Fatima as an older woman because research is that older women are more prone to cervical cancer. So let's choose 51 to 60 years old. So next, number of sexual partners in your lifetime, let's say it's 7 plus. Next, have you ever tested for positive HPV? Yes, tested positive. Next, and what was your last pap test result? Abnormal cells detected. So get results, it will indicate higher risk. You see, 60% estimated higher risk. So personalized recommendation for Fatima is immediate consultation with a gynecologist. Follow all screening appointments. Next screening is 6 months or as directed by the gynecologist. So the NHIF coverage, it costs 0 because NHIF covers for pap smear, HPV, and basic consultation, and then there are additional costs which you will be required to pay. So it also locates you to a nearby health service provider, but we are going to work on it. But for now, it has like Nairobi Women Hospital where you can go if it's your nearest service healthcare provider, and Kenyatta National Hospital. So we are going to log in as the doctor, as a doctor now, and we are going to use Hope. So my name is Hope at gmail.com, and my address is admin 123. So healthcare or admin provider. So sign in. It will direct you to the dashboard of the healthcare, and you see, welcome Dr. Hope, manage patient assessment and care plan. So it will tell the doctors the number of patients that there is. There's 3. 1 is at a higher risk, 9 are pending for screening, and you have 25 assessments today. So recent patients, the ones who are very recent with the assessment, is Sarah Johnson. It will indicate like Sarah Johnson has a lower risk. You can view details. It can show you your age, your risk levels. Her risk levels is 15%, so it's low. Last assessment was, it will indicate the date, the risk factors, sexual partners, HPV, all of those: menstrual history, regular, recommendation, action, everything. It works. So yeah, and you can also refresh it. Okay, now we are going to take you through our not dashboard, our chatbot, our AI assistant, and we are going to ask it if it's basic questions. So we're going to start with what's a pap smear. So what is a pap smear? And it's going to answer that pap test checks for abnormal cells in the cervix. It's recommended for women aged 21 to 65. Another question you can ask: what is the cost of a pap smear? What is the cost of what's the cost? So it will tell you that good news. Maybe you didn't know that a pap smear NHIF covers for it. So good news, NHIF covers pap smear text and basic consultation. Next, I'm going to show you about our solution is the data tools. So basically the data tools is where data scientists or doctors can upload data sets for data collections, or when you've collected the data or get data from another organization, you can upload and it can be used for model training and you can view the analytics. Also, there is an API integration. Let's say another organization has a model and they want to like test it with our solution to give them results of whether a patient has a higher risk, lower risk, or moderate. They can just send their API and it will be able to connect to the model. Yep, that's it for our solution. Thank you.